great time to bring attention to this chronic disease. And my guest via telephone is Dr. Griffin P. Rodgers, Director of the National Institute of Diabetes and Digestive and Kidney Diseases. And first, if you would tell us a little bit about your organization and your mission.
Sure. Well, the National Institute of Diabetes, Digestive, and Kidney Diseases is one of the 27 institutes at the National Institutes of Health. And our institute is responsible for, I would say, some of the more common and chronic and costly and consequential disorders affecting Americans today, that, for that matter, people throughout the world. Diabetes and other metabolic conditions, obesity, GI diseases like ulcers and inflammatory bowel disease and liver diseases, as well as kidney disease, benign urologic conditions, and certain types of blood diseases like sickle cell anemia.
And how are you funded?
We're funded through the federal government. Your taxpayer dollars actually funds the research that we conduct both on our campus as well as throughout universities and hospitals and medical centers throughout the United States.
Okay, and doctor, please give us a refresher course on what diabetes is and what's the difference between the two types.
Sure. Well, diabetes is a condition in which the body ability to keep the blood sugar level in our bloodstream under good control is influenced by a hormone that's secreted in the pancreas called insulin. And there are basically generally two types of diabetes. Type 1 diabetes is a condition in which the body, for unclear reasons, triggers an autoimmune response which kills the cells in the pancreas that's producing insulin. So it used to be called juvenile diabetes. The other form, which is more common, is called type 2 diabetes, or formerly called adult onset. Here's a condition in which it's not that the body isn't making insulin, it's just that the insulin doesn't work well in bringing the sugar into the cells. This is often as a result of insulin resistance, a direct consequence of being overweight and obese and the effects that metabolic derangement has on one's blood sugar control.
Okay, so we're always concerned with South Carolina and how we're doing in comparison with the rest of the nation, and so you guys have a unique perspective. Can you tell us about some numbers in South Carolina?
Well, in South Carolina in general, compared to the rest of the United States, you tend to be doing a little bit worse, both in terms of the prevalence of obesity. 35.1% of the adults in South Carolina are considered overweight or obese. 35% are overweight, 32% are obese, and perhaps as a direct consequence of that, the overall average of 9% diabetes is exceeded in the state of South Carolina. And for that reason, it's why, and particularly during the holiday season, we try to bring people's attention to this because, what's driving diabetes is really the obesity epidemic that we're seeing. And we kind of like to use this time during the year to encourage your listeners to think about reaching and maintaining a healthy weight. Either if they have diabetes, that's a good idea, but if they, are on the cusp of developing diabetes, so-called prediabetes, developing a healthy weight by reducing the amount of sugar and added fats and salts, exercising 30 minutes a day, 5 days a week, is a good way to try to keep that weight managed and thereby reducing one's risk of going on to develop diabetes. So during the holidays in particular, saying no to a lot of these holiday treats that you're having, we know that you're not going to completely be able to say no to that nice apple pie, but maybe having a smaller slice, for example, or
then maybe exercise afterwards.
There you go.
Yes.
Exactly. Or for example, when you get together, really focus more on, making it more about the festivities and not the food. You're here there together with your friends and family to have fun, and so maybe you could have a holiday-themed playlist, or maybe you can have a dance party and kind of remember the dances you used to do in the 80s and the 90s and, 2000s,
Mm-hmm.
and so in that way you kind of get some exercise in without even knowing about it.
Now, if I understand correctly, you can, if you are borderline diabetic,
Mhm.
there are things that you can do, like you're mentioning, that you can reverse the process.
Yeah, our national diabetes prevention program, which was a large study that was funded by our institute, and it included all Americans, but we had sufficient numbers to really break this down to see whether it held up in various racial and ethnic groups. Exercising, again, 30 minutes a day, 5 days a week, again, mostly walking. You didn't have to join a expensive, gym, and reducing the amounts of calories that one consumes, lowering the amount of sugar and fat
Hmm.
and things of that sort, in order to reduce one's weight by about just 7%.
Okay.
And so for a typical, for a person who, say, is 200 pounds, just reducing 14 pounds over time, reduce one's risk of developing diabetes in those that had pre-diabetes by close to 60%. And that effect seems to be durable now. We're following these patients on this study now going into the 15th year, and just that intervention alone continues to reduce their risk of developing it. So it really is, and it's the most remarkable thing. We had enough people who were over 60 at the time that they began the study that we know that in people who are, 60 or older, that exercise and reducing calories were extremely important for them. They reduced their risk by greater than 70%. So it's
Wow.
never too late to start,
Okay. Now, the National Diabetes Month theme, tell us about that.
Well, the theme for this month is that you are at the center of your diabetes care. By that, we mean that, we know that having a chronic condition like this, you're going to have to see your doctor, and often nurse, and maybe a diabetes educator, a dietitian, a podiatrist, ophthalmologist. But really, it's the patient who's really at the center of their management. So we consider them to be the center of their diabetes care team.
All right, Dr. Griffin P. Rodgers, Director of the National Institute of Diabetes and Digestive and Kidney Diseases. Where can people get more information about NIDDK?
Sure. Well, if you have diabetes, or if you have prediabetes, or certainly if you have a family member, so you might be at a risk, you can get more information not only about diabetes, but again, during the theme of the holiday season, you can learn more about ways of managing your weight and what you eat, those types of things, by visiting our website at niddk.nih.gov. We also have a toll-free number if people want to maybe be less sort of internet savvy. They can call 800-860-8747.
All right, Doctor. Thank you so very much for your time. We do appreciate it.
Thank you. I really appreciate it.